Dr. Fotuhi, welcome. It's an immense pleasure to have you with us today.
It's my pleasure to be on your podcast. Thanks for inviting me.
Dr. Fotuhi, you have spent over 30 years studying the brain. Before we dive into the specifics behind brain health, can you help us understand where your passion for the brain comes from?
My passion about the brain began when I was a child. My father always talked to me about how there is no limit in what our brain can do. And then when I was in college, I took a course in physiological psychology and I just loved it. It was about how the changes in our brain affect the changes in our behavior and how our behavior is really a manifestation of these chemical reactions in the brain. I just melted that day in the classroom. I remember it was a full class. There was no seating available. So I just had to sit on the floor and I just listened to the professor. I just melted. I said, my God, this is so fascinating. And then ever since then, I've been studying the brain every day. Every day, I'm constantly reading, writing, talking about the brain. And I never get enough of it.
Beautiful. And you, in your new book, The Invincible Brain, you talk about the 5 pillars of brain health. And I was wondering if you could begin by sharing with our audience what are those 5 pillars, and then we can dive into each one of them.
I believe that the 5 pillars of brain health are exercise, optimal sleep, optimal nutrition, mindset, and brain training. These 5 pillars of brain health literally shape your brain. Every day, when you do a little bit of these things, your brain actually grows at a microscopic level. It grows just a little bit, literally, not theoretically or abstract way, actual volumes in millimeters. And when you do more of these things on a regular basis, your brain capacity increases and your brain volume increases.
That's fantastic news, particularly in a world where we're seeing so many individuals that are diagnosed with Alzheimer, with dementia. And I want to dive into each one of these to understand how our audience could potentially implement specific practices that can actually turn them into super agers. Maybe let's begin with exercise, because I know it has phenomenal powers for not only the brain, but also the heart.
Exercise is the single most important thing you can do for your brain. When you get fit, you increase the number of mitochondria, which are energy producing organelles inside your cells. Your cells become more powerful, literally. And then as a result, they function better. Exercise can also increase the number of neurons in the part of the brain for memory, which is called hippocampus. So this part of the brain is roughly the size of your thumb. You have one on the right, one on the left. And hippocampus is ground zero for learning and memory. And with Alzheimer's disease, hippocampus shrinks to almost half its original size. And that's why people can't learn new things. That's why people ask the same question multiple times. So exercise is the best remedy for prevention of shrinkage in the hippocampus. People who have better fitness have larger hippocampus and they're less likely to get Alzheimer's disease. Exercise is really the fountain of youth.
And it's absolutely fascinating because when you're talking about the hippocampus as well as the cortex that actually shrink 0.5% per year, knowing that we all have the possibility to take ownership of our own brain health is very, very inspiring. How much exercise would one person need for them to make sure that they prevent this shrinkage of the hippocampus?
That's an excellent question. What's important for people to improve their level of fitness one notch? Ideally, you should be able to go up 10 flights of stairs without stopping. You should be able to walk 3 miles rather easily. Those are sort of basic levels of fitness that I think everybody should have. These days, there's a way to measure your level of fitness with a test called VO2 max. VO2 max is the maximal amount of oxygen that your body can consume at your peak exercise. And these days, you can go to some athletic facilities, some doctor's offices, and also many smartwatches have that VO2 max because when you walk 2 miles, you can measure your approximate level of fitness. Once you know your VO2 max, you know your level of fitness, and there are guidelines of optimal fitness, optimal VO2 max for men and women in different age groups. So, for example, I'm in 60s. My good VO2 max would be 30 to 35, and an optimal will be 35 to 40, and mine is 40. So I know that I'm keeping my VO2 max at an optimal level for my age. But for a 25-year-old, the VO2 max probably would be 60.
Fascinating. So, in simple terms, if someone just takes a daily walk, is that enough? Would they need to push their heart rate to a higher level and engage in aerobic exercises or maybe some bicycling or other, dancing, whatever really brings joy to individuals? What would you recommend from that perspective in terms of increasing the VO2 max?
I think important thing is what you said, which is you have to enjoy it. So that's number one. And number two, you need to be in good shape. And I think people know what a good shape is. If you have a sedentary lifestyle, if you work at a desk all day, you go home, you watch TV, you eat dinner, you just spend time on social media, obviously that's not optimal. You want to be active, and anything is better than nothing. So if you walk 10 minutes a day, it's much, much better than doing nothing at all. And then when you exercise 45 minutes, 4 times a week, even better. My general recommendation is stay active during the day as much as you can. Like take the stairs up the elevator, just be active, and then do 3 hours of exercise. You can do 3 1-hour sessions, or you can do like you can play tennis for an hour and a half, and you can do pickleball for an hour and a half. Roughly, I think 3 hours a week is a good amount of exercise for an average person. But the bottom line is you need to maintain your fitness. You have to feel that you're in good shape, that you don't get short of breath just going up one flight of stairs. And if you have to catch a bus or you have to run after something, you can actually run. I think people know what the average level of fitness is compared to other people. So that's a good gauge. And if not, just set a goal of being active most days and then do 3 hours of exercise total per week.
Amazing. Let's talk now about another important factor among the five, which is tied to nutrition. What advice would you have for our listeners in order to optimize the choices that they make every single day to really maintain optimal brain health?
That's easy. You should avoid junk food at all costs. You should really don't eat donuts and, pizzas that are poorly prepared. And you should not sit and eat a whole bag of chips, French fries, cookies, sweetened sodas, sugary sodas. You want to avoid highly processed food, food that are high in trans fat, and sugary food. These types of food increase inflammation in the brain and reduce blood flow in the brain. So the most important thing for people to do is to avoid junk food. Unfortunately, these days we're surrounded by junk food. Like if you go to a ball game, or if you go to a concert, or if you go to the event, you're just surrounded with junk food. It's hard to find some real fruits and vegetables, like a nice salad. You can't. Like, I was at a train station in New York yesterday, and I looked around. I looked at so many stores, just looking at the foods they had. They were all poorly prepared, they're all like greasy. So it's challenging, but if you really want to improve your brain health, if you really want to have a healthy heart, a healthy brain, you should avoid junk food. People avoid smoking. And in 1950s, 60s, and 70s, everybody smoked. Most people would smoke in social gatherings, they would smoke in airplanes. And people found out that as much as smoking is everywhere, it's bad for you. It took 40 years, but these days, in the United States, you don't find people smoke in restaurants or bars, in cinemas, or social events. And I think that same thing needs to apply and happen for eating junk food. Junk food is like smoking. You shouldn't eat it, period. Now, if you have avoided all junk food and okay, I don't eat junk food, what good food can I eat? In general, Mediterranean diet has been shown to be particularly effective for keeping your brain young. These are things like eating fruits and vegetables, and use extra virgin olive oil, and having a bowl of yogurt every day. Those are sort of a common healthy food. But if you're eating a vegetarian diet, or if you're eating in diet that's commonly available in China or Russia, and it does not have junk food, as long as it's healthy, it's okay. It's good for you.
It's interesting you're talking about the 40 years that was connected to understanding that smoking was not good. And recently, we've seen the inversion of the food pyramid that also took 40 years to actually enlighten us on how we can eat more healthy. And I want to talk more specifically about carbs, the pasta, the rice, the things that many individuals consume. What are your thoughts on that? And I know based on a lot of the research that I've been doing, let's just call them the bad carbs because there are also good carbs in certain vegetables and fruits. Would you recommend for someone to limit their overall carbs if they can? The bad carbs, as I said, more the starchy carbs like bread and pasta and rice for optimal brain health or not?
I think a high protein diet is good for the brain, and a diet that's high in omega 3 fatty acids, which you find in fish like salmon, are good. When it comes to carbs, I eat a low carb diet myself. I eat some rice every day or most days. I eat one or two slices of bread here and there. I don't sit and eat a whole plate of rice anymore. I used to. I used to enjoy it. I miss it actually. And as you said, there's good carbs and bad carbs. There's simple sugar molecules that spike your sugar in your blood quickly, and the complex carbohydrates that have complex molecules that are two, three, four in a chain that do not spike your sugar level. For example, if you have apple or an orange, not so much watermelon, but most of the fruits that you eat, they do have sugar in them. So they increase the sugar levels in the blood, but they do it slowly. What happens is that when you have a sugary soda, for example, or if you have a lot of white rice at once, it can spike your sugar levels quickly within like half an hour. And that spike in sugar, called high glycemic index, causes a spike in insulin levels. So what happens is suddenly you have high insulin levels after, eating a small amount of carb. But that insulin makes you hungry, and then you eat more because that insulin actually makes your sugar level fall and you become hypoglycemic, and then you want to eat more, which is what happens. People eat, for example, a sugary high carb breakfast, and an hour later they're hungry again. It's true because they're hungry for real, because the sugar has caused hypoglycemia, and that causes them to feel hungry and eat more. So they have another soda or a cookie, spice the sugar, and then the whole cycle continues throughout the day. And you see a lot of people who are like addicted, literally addicted to having a lot of sodas every day. So the bottom line is this: when it comes to the best food for the brain, you want to eat things that reduce inflammation, increase blood flow, and help with the rinsing and cleansing of the brain that happens at night. And the best diet to do that is a Mediterranean diet with a small amount of carbs, high levels of protein, make sure you drink enough water every day. And then for snacks, you can have some fruits, for example. Like I may eat a pear, an apple, an orange, a tangerine throughout the day. I may have a small handful of pistachio as a snack. And for lunch, I usually have a small bowl of yogurt. And for dinner, I usually have, a piece of salmon with some vegetables, or I may have a piece of chicken with some vegetables. It's not that difficult. I think common sense eating is actually very simple. You don't need to make it too complicated. Just don't eat junk food and eat a lot of fruits and vegetables. It's pretty simple.
Yes. What about intermittent fasting? I was reading that it actually rewires your brain. What does your research tell us about intermittent fasting? And do you recommend it?
I think we need more data before we can make a general recommendation. The data on intermittent fasting is mixed. I think we don't need to eat 3 times a day. Personally, I think eating twice a day is plenty. You want to eat food in the morning that don't spike your sugar levels. If you eat something like oatmeal or high fiber diet, it will increase your sugar levels very slowly through the day. So around noon, you're not hungry that much anyway. You can have a small something, fruits or just small yogurt. And then around 5 o'clock, you can have dinner. And you don't want to eat too close to bedtime. You want to eat like 4 or 5 hours before bedtime. And so I think I don't recommend personally intermittent fasting because I think data is not enough. However, I do eat twice a day myself. I don't consider that fasting because, I may want to eat an apple during the day.
All right. Wonderful. And let's touch upon the third topic, which is sleep, which is absolutely essential for the brain. Tell us more about that and what it does to the brain, why it's so essential. The typical research says 7 to 8 hours. Is that your view? Can you dive as much as possible into the subject, please?
I think sleep is very essential for our brain health. During the sleep, a rinsing process happens. It's so interesting. You go to sleep and you wake up, you think like it was a passive period that you were just, flat on the bed, just doing nothing. But it's fascinating of how many things are going on in the brain in the middle of the night. Let's compare to what happens in the middle of the night in New York. All the garbage bags get collected, all the trash get collected, mostly middle of the night or like 4 or 5 o'clock in the morning. So there's a whole level of cleaning that happens in New York around 4 or 5 o'clock in the morning. Now, the same thing happens in the brain. In the middle of the night, especially during deep stage of sleep, all the extra metabolic byproducts that have been generated because of the metabolic activity in the brain are cleared. When your heart pulses, a pulsation of the heart pushes the brain fluid, which is called CSF, cerebrospinal fluid, to go from arteries to the veins. And with each pulse, it gets the rinsing like that. Now, why does it happen more at night than during the day is the subject of research. But we know that pulsation of the arteries is what pushes the fluid to rinse the brain. And then this dirty fluid is then collected on the venous side and is drained out of the brain. It's fascinating. And all of these things happen during deep stage of sleep. So if you don't get the deepest stage of sleep, then the amyloid, which is the toxic protein that accumulates with Alzheimer's disease, goes up because one of the things that usually gets cleaned in this rinsing process is amyloid. And for example, it was a very clever study that was done a few years ago. Researchers kept some of the subjects awake for a whole night, and another group just went to bed regularly. And then they looked at the fluid from their back, the cerebrospinal fluid, and they measured and they saw that people who did not get one night of sleep, just missing one night of sleep, had increased amyloid levels in their brain. Just one night of not sleeping. Sleeping is essential for keeping the brain clean. The other thing is that most of our memories are consolidated during deep sleep. So much of what happens during the day gets consolidated and extra things are purged during deep sleep. So a lot happens during the sleep and you can't cut it short. Some people say, oh, I wish I didn't sleep. I can get so much more work done. People need to appreciate that a lot of work is getting done in their brain when they're sleeping, and they can't really compromise on that. One problem that happens often is that a lot of people think, well, everybody is having sleep problems. I'm just like everybody else. Or as you grow older, with all the stress and all the things going on, who can get a good night's sleep anyway? That's a bad approach. I think people need to look at sleep as something that can be improved. If they have difficulty falling asleep or staying asleep, there are usually 5 or 6 easy to fix issues. For example, they may have had coffee or caffeinated beverages during the day. They may have had a stressful day. They may have eaten spicy food. Maybe the bedroom is not dark enough, or the bedroom is not quiet enough, or the mattress is not comfortable, or the bed sheets are not nice and clean and fresh, or the bedroom is too cluttered. I always say that the bedroom should be used for 3 things: reading, sleeping, and sex, nothing else. So don't bring your computer, don't bring your Peloton bike, don't bring your desk. Your bedroom needs to be a serene, quiet place that you just sleep there and you don't work or do exercises there. So bottom line is exercise is critically important for the brain. And if you're not getting optimal sleep, in my book, I have a whole chapter about finding what things cause sleeping problems and 20 different solutions on how to treat them.
Fantastic. And let's now dive into stress management. How can we optimally manage stress for optimal brain health?
Unfortunately, that's probably the most brain killer of all the things that people do. Among like poor diet can cause problems, poor sleep can cause problems, sedentary lifestyle can cause problems, being mentally lazy can cause problems. But stress is a real brain killer because stress causes increase in levels of cortisol. Cortisol is the stress hormone that spikes when you're in stress, when you miss your flight or you are late for something, or you have a deadline at your work, or something that's stressful, or somebody has a medical emergency in your family, things like that. Unfortunately, in today's world, many people are stressing over too many things throughout the day. They're stressing about emails that did come or did not come, about work related relationships, about family relationships, about dealing with children, about politics, government. There are a lot of things that stress people. And when you go to the airport and you look around, or when you're sitting in the metro and you look around, you see a lot of people who clearly look stressed out. And that's unfortunate because we generate our own stress. It's our interpretation of the world that triggers the cortisol levels to go up. You can both be sitting in a metro next to each other, and one person is stressed and one person is not because of what they're thinking about. It's the thinking and creation of ideas that generates stress, which then causes the hippocampus to shrink. The high levels of cortisol shrink the hippocampus more. So that's a one thing I hope people will consider reducing. And there are many things people can do to reduce their stress. Sorry. One simple thing is the slow breathing exercises. You just sit comfortably. You don't have to close your eyes, but you can close your eyes if you want. And then you breathe in with a count of 6. You hold for the count of 3, and you breathe out for the count of 6. So 6 in, you hold for 3, and you 6 out. If you do that for even 2 minutes, you feel so much better. If you do it for 5 minutes, even better. And these days, there are lots of free apps that people can use to maintain that breathing, because what happens is after 4 or 5 cycle, people remember about all the emails they haven't sent, all the phone calls they have to make, all the things that are on their place, and they get distracted. There are apps that can help you to maintain your attention while you do this breathing exercise. Of course, meditation is great, yoga is great, Tai Chi is great. You can find something that works for you, something you enjoy. But if you want to have a healthy brain, if you want your brain to not get dirtied with cortisol, if you want to think of it that way, then make it a priority to minimize your stress. You can't have a situation where there's zero stress. Everybody has some stress. And in fact, a little bit of stress is actually good for you. It's called eustress. So if you have a little bit of stress for exams or deadlines, it keeps your attention higher, you work a little harder, higher, more, you accomplish it more. So I think it's not like we should have zero. Some appropriate level of stress is good, but chronic daily stress every hour is horrible.
So when we talk about joy, joy is like the bubble bath for brain.
I can think of it that way. I think we need to rethink our problems and situational stress and realize that our life is a dream life for a lot of people in the world. I think every once in a while we need to sort of pause and realize that we have an amazing life compared to the kind of lives that people have around the world. Billions of people would dream of the life we have in this other world any day.
Yes, and to be grateful about the chance we have. Because gratitude is also tremendously powerful at the level of the brain.
Mm-hmm.
Let's dive into the final topic, which is purpose. Tell us more about why purpose is important for brain health.
Purpose gives you direction. Purpose gives you a reason to want to get up in the morning, exercise or not exercise, eat well or not eat well. When you have a sense of purpose, when you find something that is meaningful to you, your brain is healthier. So, for example, let's say you have a sense of purpose to take care of your grandchildren and make sure they go to college and are successful, and you really feel passionate about that. Well, if that's what you have in mind, then every day you want to be a little healthier because you want to be able to spend time with your grandchildren and play balls with them or go places with them. Or if you have a sense of purpose to be a good Christian or a Muslim or a Jewish person, it gives you purpose to do the things that you know are in line with your faith. Or if you have a sense of purpose that you want to reach age of 90 and be sharp and independent, that's a good purpose. Well, if that's the purpose you have, then every day you're confronted with choices, what to eat, whether you take the elevator or the escalator or the stairs, or whether you eat this food or that food. Every day you have choices. And if you are really driven to be 90 years old and independent, then you make those choices every day. So a sense of purpose is a powerful guide that determines the direction of your life. And if you don't have a sense of purpose, you can gain it. It's not like some people have it, some people don't. It's true. You feel passionate about educating the world about the points that you find passionate about. I feel passionate about educating the world about prevention of Alzheimer's disease. I feel excited when I do this podcast, or give lectures, or write my book, because I feel it's an important thing. And everybody who has a sense of purpose has that level of excitement, which then translates in a healthier brain. Now, it turns out people have a sense of purpose in life. They live longer. They have a 50% reduction in the risk of developing strokes, a 20% reduction in risk of heart attacks, significant decline in risk of mortality. They sleep better, and they report enjoying everything, including sex. So when you have a sense of purpose in life, you really live a different world. You're calmer, you're happier, because every day you are in line with what you feel passionate about.
Indeed, and purpose, as you said, allows us to make optimal choices that are in line with the possibility of achieving that specific purpose. If we lack it, we may feel as if life is happening to us rather than us truly being in the driver's seat.
Mm-hmm.
So thank you so much for sharing those 5 dimensions. I want to ask you a question that relates to specific actions that maybe women can take, because research in the recent years has shown that women have a higher probability of developing Alzheimer's disease in comparison to men. Among the 5 dimensions that we spoke about, are there specific things that, in your view and your research, women need to do more of in order to prevent the possibility of developing Alzheimer?
I think one issue that applies to women has to do with level of estrogen and progesterone. When women go through menopause, the fluctuations in estrogen and progesterone cause difficulty with remembering things. It also causes vascular problems in the brain. And it's these vascular problems which are believed to be contributing to their cognitive decline issues. When I see, let's say, a 55-year-old woman who has hot flashes and also feels like she can't remember anything, I often provide reassurance for them that it's okay. After menopause ends, they will return to their baseline level of cognitive function. But these 5 pillars of brain health applies to them as much as it applies to men. And if they really want to improve their brain functions, then they really can focus on doing more of them. So you can exercise a little bit, or you can exercise a lot. You can follow a Mediterranean diet a little bit, or you can be very strict and really don't eat any junk food at all. You can pay attention to your sleep a little bit, or really make it a priority. And the same thing with stress reduction and challenging your brain. The question of why women are more likely to develop Alzheimer's disease in late life than men is still not resolved. Some people believe that it may be related to levels of immune cells. Women have a better reactive immune system, as perhaps there's something in the brain that triggers the immune reaction. And since women have a better immune system, they sort of overreact, and that may be the culprit. And there are also people who think that if you look at the data closely, there's really not that much difference between men and women in terms of Alzheimer's disease. Women live longer, and that may be one reason they have a higher risk of Alzheimer's disease, because they just live longer. A recent study showed that looked at the biomarkers of Alzheimer's disease. It was a European study, I think it was in Denmark. Looked at several thousand men and women at 55, 65, 75, 85, 90. And it looked at the blood levels of amyloid, which is a reflection of the amyloid in the brain. And they found that there was no significant difference between men and women when it comes to amyloid. Now, this is just one piece of evidence. It's not obviously the whole story. I think there is increased risk. Everything considered, there's a little bit of increased risk in women compared to men, based on all the things I have read. Huge difference, a little difference. And that little difference could be because of vascular problems that can happen when the estrogen levels drop. And so my general recommendation for women in menopause is to consider hormone replacement therapy for 2 years. Studies have shown that hormone replacement therapy for 2 or 3 years delays cognitive decline with aging decades later.
And thank you so much for sharing those insights. What about high LDL cholesterol and dementia links based on your research?
There's a very little correlation. There
Mhm.
is data to show that high cholesterol levels, especially the LDL levels, are associated with a higher risk of dementia. In fact, a very famous study that's been widely cited is the Lancet paper that showed that 45% of dementia cases in the world can be prevented by addressing 14 reversible factors. And one of those 14 factors is LDL cholesterol, along with sedentary lifestyle, hearing loss, vision loss, air pollution, head trauma. It's a long list of things, and LDL is one of them. I think if you do the 5 pillars of brain health, you're like 80% of the way there. The 20% is, do you drink 1 glass of wine or 2 glasses of wine or you don't drink? Do you drink 1 cup of coffee, 2 cups of coffee, or you don't drink? Is your LDL a little high or a little low? Those don't change the needle as much as fitness. If you improve your fitness and sleep well and you eat well and you keep your stress low and you challenge your brain, then it's okay to have a couple of glasses of wine. It's generally not recommended, and I don't recommend it generally, and I don't drink that much personally. However, if you've done everything right and you really enjoyed that glass of wine, go ahead, enjoy life. It's not going to kill you. We need to put things in perspective. There are minor issues and there are major issues. Fitness, sleep, nutrition, stress level, brain stimulation, those are major factors. These other things, like which supplement you take, is a minor. You can never take a supplement and then think you will never get Alzheimer's disease, or you can't, drink some herb or, take some medications and feel like you're immune for Alzheimer's disease for the rest of your life.
And hold on, I just want to let me just formulate this in the right way, or let me skip to the end because I'm looking at the time, and actually it's best that we maybe wrap up. So I'm going to ask you one final question. All right. So if you would have one challenge for our listeners today that they can pursue in the future, hold on, let me go back to the question because I still want to dive into this, and then I'll regret it. Okay. Sorry about this. Okay. If someone has not necessarily pursued the 5 dimensions that you spoke about in an optimal way, let's just say over the last many years, how soon can an individual expect to have positive improvements in brain health as a result of them taking more seriously the 5 dimensions? And as you said, maybe increasing the level of effort. So they sleep more, they pay more attention to stress management, they pay more attention to the choices of food that they take every day. I know you've shared in your TED talk that some of the patients that you've worked with have seen significant improvements in just a couple of weeks. Can you just dive a little bit more into how quickly can one expect optimized brain health as a result of taking on these enhanced measures to really move forward in an optimal way for their brain health?
I think 3 months is a period that people can see significant changes in the cognitive functions. So if you go to a gym and you haven't exercised in a long time and you're not in best of shapes, in 3 months, you will be significantly better. You won't be perfect, but you'll be much better shape in 3 months than when you started. And of course, if you do 3 more months, then you're going to move toward better fitness as well. Same applies to their brain. It doesn't take years. And this is something that I found very exciting because when I developed this 12-week program about 10, 12 years ago, I thought it would take 9 months to see results. And then I thought it'd take 6 months, but I saw that actually 3 months was enough to see significant improvement in objective cognitive tests in our patients. And so I believe that 3 months is a good time, a reasonable amount of time to expect significant change in memory and attention and concentration. One thing that's important, and I have outlined in my book, is to establish what are the factors for you. So you and I and your neighbor and our friends are unique. We all have our own issues. And so while there are the principles of 5 pillars of brain health, we really need to find out what are the nitty-gritties that apply to us. In my book, I talk about the 40 questions that we need to answer in order to find the contributing factors for each person, which don't necessarily fall into these 5 categories. For example, one of the questions is your hearing or your vision or where you live. Another question may be what medications do you take? And do you have high blood pressure? Do you have obesity? Do you have sleep apnea? There's a list of 40 things that I've learned over the years that contribute to memory loss. So when you go through that 40 list of 40 things, you may find 5 things that really apply to you. And so I have this thing called a brain portfolio where people can really dig in and do an inventory of all the things that are affecting their brain and then find a way to then address them and then improve. So the 5 pillars of brain health is sort of the big picture approach. But to see the best results in 3 months, you need to determine what are the specific things for you. So one of the things I have is working too much, that applies to myself. I love what I do. I don't consider it work, but I spend a lot of time for my screen, reading, writing, typing, doing things. And so, if I had to do one thing for myself, I probably would consider that box that need to be addressed, which doesn't necessarily fall into the 5 categories.
Wonderful. How can our audience discover more of your work beyond your book, Dr. Fotuhi?
Yes. I'm very proud of my book, The Invincible Brain. I think to make an invincible brain means to make your brain resilient against the effects of Alzheimer's disease. When you do all the things we just talked about, you make your brain stronger, slightly larger, which then makes it resilient to effects of these proteins that can potentially come and aggregate for no reason at all. And we know that for a fact that the healthier your brain is, the more resilient you are, and the more invincible your brain is against Alzheimer's disease. But I do have an Instagram and a TikTok and X, and I also have a website, drfotuhi.com. It's drfotuhi.com, drfotuhi.com, that I post things. So I'm trying to post things more and more to educate the public on YouTube, Instagram, LinkedIn. I'm trying to do my part to have a systematic set of information that a person can use, like a library of useful information, not just little pieces of information, but a library of all the questions that people ask me.
And I encourage all our listeners to tune in on all the platforms that you mentioned. I absolutely love your work and greatly admire the contributions you're making to our world and helping us live longer and healthier lives, which is all connected at the end of the day to our topic, joy. So, Dr. Fotuhi, it's been an immense pleasure to speak with you today. Thank you so much.
My pleasure. Thank you.